Okay, there we go. Good morning, everybody. For those of you who haven't met me, I am EZXT, and I'll be doing the case presentation today on a very common topic. I think something that we've all seen, or I get a lot of consultations about this specific problem. So without further ado, let's jump right into it. So this is the case that I saw, Mr. B. He is a 37-year-old male who came with complaints of lower back pain after lifting something heavy at work. According to him, the pain gets worse with certain movements, but is improved by resting. And according to the patient, there are no specific neurological fallout, no weakness or sensation loss. The pain doesn't spread anywhere, and the rest of his medical history was basically insignificant with normal vitals, as you can note there. So let's chat a bit about lower back pain before I get back to how we treated Mr. B. Let's jump right into it. Some interesting facts about lower back pain is that most of us, so 50 to 80% of the world's population, sometime in their lifetime, will have lower back pain. And after respiratory tract infections, this is the second most common reason why people visit the doctor. And it costs the economy, the world economy, about $100 billion a year to treat and pay outs for lower back pain, which makes it quite a significant problem and something that we all need to deal with. So why is the lower back so commonly affected by pain? So if you think about it very logically, the lower back basically supports the whole upper body and the spinal column. And it's also involved with a lot of movements such as bending or twisting of the back. And then also all the muscles of the lower back are responsible for flexing and rotating the hips while we are walking, and all of us have to walk daily. And then also the nerves from the lower back then supplies the sensation and the power of the pelvis, the legs, and the feet, which we use on a daily basis. So what are the risk factors for getting lower back pain? So I think obesity is a very common problem in our setting. Then patients who smoke are a bit more prone to getting lower back pain. Females are also more prone to back pain, and then also people who use their back incorrectly. So people who lift heavy objects without using their legs, using their backs, patients who are exposed to vibrations. So these are patients who do long distance driving, can also be people who have to work with heavy machinery. But even our patients that sit in an office the whole day in an incorrect position are also very prone to getting lower back pain sometime in their life. So just briefly touching on what are the most common causes for lower back pain. So I think the most common one that we often see is mechanical or axial back pain. This is usually caused by either the muscles, the ligaments, the joints, or the bones in and around the spine. And this type of pain, usually patients will complain that it is localized to the lower back, but sometimes also the buttocks and the top part of the legs can be involved. And this type of pain is usually influenced by certain motions and movements. So the second most common cause of pain that we see is radicular pain. So this type of pain is usually caused by a nerve or impingement of a nerve or inflammation of a nerve even. And patients will typically complain of electric burning type of pain, very sharp. And what makes this pain very unique is that it's usually confined to the area where the nerve has to innervate the skin and the muscles. So they might have weakness or numbness in the area where the nerve usually runs. And I think the most common one that all of us know is sciatica. And this is where patients commonly complain of an electric shock going down the leg, down into the calf, into their foot. So how do we classify back pain? So we can just very broadly categorize it into acute, subacute, and chronic type of pain. So acute type of back pain, this is usually a sudden onset back pain that will resolve within about 6 weeks. And this is usually the body's normal reaction to an injury or tissue damage. So just briefly touching on acute back pain, which is usually caused by either a strain or a sprain. So the difference between a strain and a sprain was quite interesting to me to just recap again. So a strain is usually caused by a muscle that is overstretched or torn, while a sprain is the ligament that gets overstretched or torn. And this is usually caused by using the back incorrectly. So lifting heavy objects, a sudden shock on the back, so something like a fall might precipitate this, or then poor posture over a very long time. And very commonly, we see this in sports injuries. So subacute pain, this is lower back pain where patients have pain for longer than 6 weeks, but for shorter than 3 months. This is also usually due to a strain or a sprain. And at this stage, we might need to consider doing a medical workup for these patients, especially if the pain starts debilitating the patient's activities of daily living, where their sleep or working gets disrupted by the pain. Then chronic back pain. This is usually pain that is there for most days, for more than 3 months. Pain is usually so severe that it does not really respond to our initial treatment options, and these patients will definitely need further workup to find the possible cause for the chronic back pain. So chronic back pain, I'm not going to go into all the causes. There is a very long list, as you can see, but most of the causes are due to either degeneration, whether it be the disc, the joint, and then always keep in the back of your mind something like cancer. It might either be a spreading of a cancer to the lower back bones, or then if patients have something like trauma or an infection, etc. But I'm not going to go into too much detail. Just remember that chronic back pain is usually associated with degeneration or an old injury that has been progressing over time. I think this is probably the most important slide that I want you guys to take home. And these are the red flag signs of lower back pain. So what are the danger signs we need to look out for and identify in patients that we see? So any patient that come in complaining of lower back pain for some time, whether it be acute or chronic, who have associated incontinence of their bladder or bowel function, this is an indication to refer them immediately. Patients who complain of having weight loss without them trying to lose weight, this might make you think of possible causes like cancer. And then if they have associated, say, fever and chills, always keep in the back of your mind in a South African setting, something like TB of the spine. And then if patients have a preceding history of trauma, and then after the trauma having back pain, always remember that there can be a fracture or impingement or dislocation that can be causing the pain. So this might need further workup. And then pain that is so severe that it disrupts the patient's sleep also need referral. And then pain that is confined to the thoracic area might also be a bit more sinister than something like lower back pain, for instance. So how do we make the diagnosis of lower back pain? A specific diagnosis. So I think a history here is probably the most important thing. So always ask about the nature of the pain. I'll go into a little bit more detail on the nature. So the nature of the pain might give you a good indication of what the possible cause is. And patients complaining of a dull aching pain that is usually confined only to the lower back, it's usually due to muscle spasms. And then, like I mentioned before, if you have a radiating pain, so pain spreading from the lower back to the buttock, legs, and feet, this might give us an indication of something like a nerve impingement or sciatica. pain that gets worse with sitting might gives us an indication that there is more pressure on the disc. So think of possible disc problems, whether it be disc herniation or degeneration. There's lots of causes for disc problems. And then pain that gets better when a patient leans forward. Typically, you'll get an older person telling you that when they go to the shop, they want to lean on the trolley, they get good relief of their pain. This is usually an indication of something like spinal cord stenosis or impingement of your spinal cord. And then pain that is usually worse after waking up in the morning. Patients complain of stiffness in the morning. This might give us an indication of degenerative problems or something like osteoarthritis. So on our physical examination, medical school, they used to teach us you look, listen, feel, and then you do your special tests. So when you look at a patient, always see when they come in the door, are they walking funny, or they're walking with a limp. Look at the back physically. Do you see any deformities? You can feel, if you feel anything that feels funny, something that's out of place. And then we can't really listen to the back. But then if you do your special test, this is usually things that will get done by a doctor, but they will do a full neurological examination, can test your range of motion of the back. Can the patient still bend in all directions? And then special tests, especially something like a leg raise test, might give you an indication whether there is nerve impingement or not. But I don't think you have to worry about this too much. And then we can confirm our diagnosis, whatever we think might be the reason for the back pain, by doing imaging. So x-rays, we usually start off with x-rays, but if you suspect a nerve impingement, something like an MRI scan might be a better idea. So how do we treat our lower back pains? So you can we usually divide it into non-surgical or surgical treatment. So I'm going to focus more on the non-surgical treatment because this is something that we will deal with in our clinic. So usually we advise the patients to rest. If they do pick up or do manual labor at work, maybe take a break from work, rest a bit. Pain medication, so multimodal analgesia or pain medication is usually your mainstay of treatment. Then you can advise patients to either use heat or ice. Ice will be more for your patients who have an acute tear or swelling, while heat might be more for your spasms or your chronic type of back pain. And this also gives some good pain relief. Then physiotherapy, it's something that I firmly believe in. I think, having struggled with lower back pain before, I think I've seen the wonders that physiotherapy can do for back pain. And then you can consider things like back braces. If you find that you have persistent pain with these measures that you've put into place, I think this is usually the time where I would start considering referring my patient to a specialist who will then decide upon surgical intervention or not. So very good news for our patients. Usually 90% of lower back pain will resolve within 1 year. So I think this is good news for our patients. So let's get back to Mr. B. How did we treat him? So just by looking at his history, the most likely cause for his back pain is acute sprain or strain of the lower back, because he gave us a history of lifting a heavy object at work, and his pain that it gets worse with certain positions, and that's better with rest. So how did we treat Mr. B? I gave him a prescription for some pain medication. I prescribed Coxia, which is a COX-2 inhibitor, and then also Norflex Go, which is a combination of paracetamol and muscle relaxant. Then we advised him to use a heat pack on the affected area. We gave him a sick note to rest from work. And then I also referred him to a physiotherapist who will help him with some exercises and strengthening. And then we told him to follow up if there are any worsening or if he starts experiencing any red flag signs. So just after listening to this case, what can you change in your practice? I think once again, I want to refer back to the red flag signs. Lower back pain is something that we so commonly see, but I think next time maybe just think of asking the patient about certain red flag signs. So ask about whether there was any trauma, ask about the bowel and the bladder function. Does the patient experience any weakness or sensation loss? And then also know which patients to refer immediately. You can look physically for any deformities, check the mobility of the patient, and then also counsel your patient on which red flag signs to look out for. And I think the most important probably for our patients is to just reassure them, let them know that they should within a couple of days or weeks, the back pain should usually resolve unless there is a different cause for it. And that's it from my side. If there are any questions, you can either email me or I don't know if there's time to ask now.
Yeah, no, thank you very much, Dr. Extien. It was very informative and excellent presentation. So just remember, guys, if you have a question now, just unmute yourself because everybody's muted. So if there is any questions, just go for it. I'm just going to open up the floor there quickly.
Hey, doctor.
Hello.
Morning. How are you?
Well, thank you. How are you?
I'm good. You're speaking to Sister Kekana.
Hi, sister.
I want to ask the one for referral. Which ones can we refer exactly when they came to a clinic with the problems of pain, of back pain?
So I'm just going to refer back to this slide on the red flag signs. I think these are patients that will need referral. So these are the patients that, and then I also want to mention just your patients who come in with chronic back pain. So for more than 3 months, I think these patients do warrant a referral for further workup. But then patients who complain of any bladder or bowel incontinence where urine or feces just leaks out, patients who have any weight loss without them trying to do that, patients with signs and symptoms that might make you think of TB, refer them for further workup. And then any patients who have very, very severe pain that wakes them up at night, patients who had any trauma, and then I think pain that is more specifically in the thoracic area, you might need to consider to refer them. Yeah, I hope this answers your question.
Okay, yes, thank you very much.
Yeah, or I would add also, if you are uncertain or any of that, then just consult with the doctor and on UDoc first. It could possibly advise also to referral states and such, or possible solutions there. Thank you. Any other questions? Okay, doctor, if you can stop your sharing. I just want to do a quick run through on the registration process. So you are welcome to drop off if you wanted to. So thank you very much for that again. We will, if there is any other questions or so, you can always email us as well. We will be adding these meetings and presentations to your iPad shortly, and we'll notify you as such as well. And just a quick one, yeah, let me just quickly also share with you my screen, the registration process quickly. If any of you had issues with that, just do a screen share here. So this is the registration process. We will email you that link, which will take you directly through to this page. And here you will gonna have to just enter your details, and then your personal email address in order to create a your own personal profile in order to do consults, not consults, sorry, well, if you wanted to ever use it for your own family or yourself. So once you registered with that details and your personal email address, you will get this message saying an email has been sent to confirm, or that you need to click on to verify. Let's just have a quick look here. So, show you there. So then you will receive an email looking like this, which is the verification email, and you will have to then click on that button just to verify your email address, and then just complete your details, after which your profile will be then active. And for those, again, that has done your the 10 or more consults on March, you will receive your 300 Rand credits. And then, yeah, you will be able to show your, to share it to your friends and family as well. Okay, I see someone has a question here. Raise their hand, just unmute yourself, yeah.
Hi, Daniel. It's Lona from Gooks. I had my profile created already before this new campaign now of having to get points and all of that. So should I create another one, or what's going to happen?
Yeah, no, not at all. So as that previous email also stated, we just need to know that you have registered, doesn't matter when it was, so that we can backtrace it, because we don't know your personal email address. So just send an email through to us stating your name and your personal email address, so that we then have we then know who you are, and then we can actually go and find you. So no need for any registration. I see there's another hand up. You can unmute yourself there. So we only have 2 minutes left. So there's another hand raised. Just unmute if you wanted to ask anything. Just quickly, let me see if I can go back. So in this state, if you ever do get, once you've started the registration process and something happened, you don't get the email or such, just look at this page where it asks you to check your email to verify your email address. Here is a button that you can click on to request a new email address. So even if something bombs out, doesn't work, that first initial steps that you took, where you put in your name, your email address, and your password, you can then, at a later stage, if you actually then go to, let's just log out here. So you come back to this page, then you can actually go to the login page. You log in with that specific email address that you've used, your personal email address and your password that you created. Once you've logged in, you will then go back to this page, where you can click on request a new, another verification email that will allow you then to actually verify and complete your profile. But I'll send an email through to all of you again, just to confirm that you need to please register, if not yet, and also then email us and let us know your details that you have registered with, so that we can obviously track and see or match your account to the clinic that we know that that is you, and that we can actually then load credits where due. All right, is there any other questions? I think we have a couple of seconds left.